Liposuction has been around a long time, and it does a great job at removing unwanted fat. But there's two things that has never been really addressed: loose skin and getting people back to work right away. The body tight and the neck tight uses radio frequency energy, and it helps shrinks the skin at the same time that you're removing the fat, and it allows me to have my patients on the Dr. Oz show in less than a week. Stay with the high-profiled implants.
Is not the best option for Jessica.
We can take these new silicone gel implants that have these higher projecting qualities and literally give a breast lift simultaneously with giving more fullness. Unbelievable, because all these technologies that are all involved inside of this machine have been things that we've been using for a long time, and now we're able to combine them to get unbelievable results.
That's exactly it. In the past, yes, we used radio frequency, yes, we used liposuction, but separately.
Exactly. And now we're trying to kind of combine them, and you get quicker results. And as you'll see by what you're going to see in a minute from Denise, and what you saw there, she's doing it with just a little bit of oral sedation in the office, and it's amazing.
Thank you for being here. Excited. Thank you very much. Thank you. Get comfortable. Big show today. I love bringing you the latest and all the new breakthrough technologies in medicine. And today, I have 2011's most incredible plastic surgery procedures for those common surgeries we do: tummy tuck, facelift, and a nose job. We'll talk about what's new in all these fields. And these cutting-edge treatments can be done in under 1 hour. Imagine that, in under an hour. And we have the results today. For the first time on this show, we are performing a revolutionary new nose job treatment live. And incredibly, this amazing new procedure does not require even one cut. Our first procedure is blowing the lid off traditional liposuction and tummy tucks. It's plastic surgery's quick fix. Almost 200,000 women now undergo liposuction every year. But many women still consider this popular procedure too invasive, with too much downtime recuperating. Until now. The latest generation of liposuction, less invasive with faster recovery, makes it an option for even the busiest working women and moms.
I'm Angela. I've always wanted to have a tummy tuck, but as a mom of 4, who has the time? Before kids, I thought I looked pretty sexy. With each pregnancy, my belly has gotten more jiggly, more squishy. Sure, my armor's on. I have many tricks to camouflage my jelly belly. If it's for controlling the belly, I have it. If I could just tighten that tummy, I will feel better, and when I feel better, everybody feels better.
Okay, Bossy, see you later.
All right. This year, I'm getting my belly back.
I'm Lisa. I'm a mom of 3, and lately I feel as if I got 3 chins. I'm 46, and I look at myself in the mirror, and I look at my chin. I feel like a senior citizen, and I feel like this is my aging area right here. I've tried lotions, potions, and creams, but absolutely nothing gets rid of this droop. It's come to the point in my life now that wherever I am, I'm looking at other people's necks. I certainly do have neck envy.
To solve their problems, we've sent both Angela and Lisa to Dr. Davis, who specializes in a cutting-edge liposuction procedure.
This new technology gives us the ability to remove the fat, and at the same time, that sagging skin, we can just shrink it, and you'll have this really tight, beautiful neck. It really will allow Angela and Lisa to have minimal bruising, minimal downtime, and they're back to work right away. You all set?
I am so set.
All right, here we go.
Board-certified plastic surgeon Dr. Davis is on the cutting edge of this new procedure. It's called body tight or neck tight. So Dr. Davis, explain to everybody and to me why you think this body tight or neck tight procedure is better than traditional liposuction.
Liposuction has been around a long time, and it does a great job at removing unwanted fat. But there's two things that has never been really addressed: loose skin and getting people back to work right away. The body tight and the neck tight uses radio frequency energy, and it helps shrinks the skin at the same time that you're removing the fat, and it allows me to have my patients on the Dr. Oz show in less than a week.
Sounds pretty good. Can everyone get it? Is it FDA approved?
It's currently in clinical trials, and soon, hopefully, it's all going to be around the whole nation.
So Dr. Davis is performing the procedure on Angela's stomach and a neck tight on Lisa's neck.
Right.
So we've got both examples of this. Now, let's take a look at Angela's before photo. There it is right there. Can you all see it? It's a side view and a front view, so we actually have a pretty good idea. Now it's time to see the new Angela. You guys curious? Yeah. A lot of curiosity out there. All right, I'm going to rotate the box. Hold on in there, Angela. And there she is. Ooh, come step down. Let me see it. That's pretty good. That's pretty good.
I love it. I love it. I love it. I love it.
Was it painful?
Not at all.
Was
Not
it
at
bad?
all. I got my belly back. I'm so excited. I am so excited. No more jelly in the belly.
All right. Here, come, take a place next to Dr. Davis over there. Now I want to look at Lisa's neck from before the procedure. And here's Lisa. There's her picture. So she has a little bit of sagging skin under her chin in her neck area. All right. So let's take a look at the new Lisa. Are you all curious? Yeah. All right, Lisa. What did the neck tight procedure do? Oh, my goodness. Come on down. Oh, my goodness. Are you happy with that result?
So happy. I have nothing to grab anymore. There's nothing there.
It really looks wonderful. Did it hurt when it was being done?
Not at all. Didn't feel a thing.
So what do you think when you look in the mirror and you see that?
I think it really takes at least 10 years off my age. It really does.
All right, come on over for a second. So Dr. Davis, walk us through what you did for these two wonderful women.
Sure. First thing is, when they get into the office, they can do this under straight local anesthesia. And what's happening is, we're actually infiltrating the area with some of that local anesthesia. They're wide awake, and then I start utilizing this special tool that has two electrodes, one that's going inside and actually allowing me to suck the fat out, at the same time shrinking the tissues, and this top one also is delivering energy to the skin, but it's also registering the exact temperature, so safety-wise, we're really, really on the mark with this.
So if I can just demonstrate this.
Sure.
This goes under the skin, this probe right here, and on top of the skin you have this sort of broader one, and it's sort of like a clothespin here.
Yes.
You open it up, and so if this is under the skin,
right,
you're under there, and this is falling on top of it, and giving us a little bit of feedback as well.
Exactly, at the same time. So it's almost like a sandwich effect that's happening. Everything in between these two things is actually causing the tissues to shrink.
Yeah. This is absolutely amazing. And I got to say, this is stunning to me.
Oh,
it's really a tribute to what technology can do. Dr. Davis, thank you very much.
Oh, it's a pleasure. Thank you. Thank you.
Angela as well. And Lisa, wonderful story. All right, now our next procedure for 2011 takes rhinoplasty to a whole new direction with a non-surgical nose job that just takes minutes, and there's no surgery.
Let's face it, we all want to better our bodies, and removing fat is usually on everyone's list. Liposuction has been around since the early 70s, but doctors are now developing an innovative way to literally shrink the fat from the inside. And our camera's got a first look as Denise underwent this exciting new procedure.
When I look in the mirror, I see a 52-year-old woman with a nice figure, and then I turn around and I see the dreaded back fat. It's disgusting. I feel very self-conscious, and I really don't go anywhere without my little garments on. It's used for post-surgical tummy tuck patients. I have done everything. I have exercised, eaten healthy. Nothing has tightened it up. It's all just flat. I had looked into liposuction, but the recovery time, having 5 children, I just didn't have the time to do that.
The answer to that problem is really this brand new procedure called the Body Tight. It's liposuctioning, but it incorporates radio frequency energy, causing the fat cells to dissolve, but at the same time, you're also tightening the skin.
Oh my gosh, so I've been waiting 10 years, and now we finally have something that is unbelievable.
Here we go, so that when these are going together under the skin, they're forming like a sandwich. We're really heating up the skin right now, and you can see some of the fat coming out. You feel pressure?
A little uncomfortable, but it's fine.
We're almost done, this side. I think there's an obvious difference between the side that wasn't done and the side that we just completed, there's not a lot of resistance at all. I'm going to put a stitch in this. That's it.
No way.
Denise is here today just a week after her body type procedure, along with her plastic surgeon, Dr. Davis. Welcome to you both. Thanks for being here.
Hi, how are you? Hi.
So this is pretty exciting stuff. In fact, this is clinical trials. You're one of 3 plastic surgeons in the United States that is using this new technology.
It's unbelievable because all these technologies that are all involved inside of this machine have been things that we've been using for a long time, and now we're able to combine them to get unbelievable results.
That's exactly it. In the past, yes, we used radio frequency, yes, we used liposuction, but separately.
Exactly. And now we're trying to kind of combine them, and you get quicker results. And as you'll see by what you're going to see in a minute from Denise, and what you saw there, she's doing it with just a little bit of oral sedation in the office, and it's amazing.
So Denise, just 8 days since your procedure, correct?
Correct.
Now what happens here, it's a combination of both fat and loose skin.
Exactly.
To get the best result, you want to remove the fat and you want to get skin tightening, which we can't do with classical liposuction.
That's it.
So she had her lumbar rolls, her back rolls, and only 8 days. I mean, no bruising.
So how does it look to you,
It looks
Dr.
very good.
Well, let's look once again at Denise's back before the procedure and after, and it really is a remarkable difference.
It's really good.
Denise, you're happy, I take it?
I am thrilled. I can wear all the tops that I couldn't wear before without my undergarments, and it's really a nice to put my jeans on and not have that extra fat.
That little roll that you had by your bra before, it's the combination of removing fat and skin tightening that has made that look better. So tell us how it worked.
Well, what ends up happening is we're putting in an electrode that has a suction cannula attached to it. And when we put it underneath the skin, that's generating some heat and at the same time sucking out the fat. On the top of the skin, there's a thermistor, or kind of like another electrode that's giving you the idea of exactly what the temperature is on the skin surface. And that gives us 2 good things. Number one, it's safety, so you know it's not getting really hot. And the second thing is you want to make it hot enough so that the skin actually will retract. Now, what we have here is a little bit of chicken fat. These lines are going to come together as it starts to heat up. So we're putting a little bit of this in between here, and let's see how well this thing works. The most exciting part of this entire technology is that it's constantly giving you feedback as to what's happening.
Because in the past, the heating used to come from the outside instead of the inside.
Right, so now we're doing it from the outside and the inside at the same time. And you can hear, it's almost like a Pac-Man sound.
I saw that
smell.
The most important part is that this is something that really can get done in the office setting so that small areas as well as large areas can still be treated. And I think that's the key, because we know that liposuction really does work. It's just that what do we do with the skin when it's loose? And this is the way to show that it really can continue to heat, and you're getting constant feedback over the course of some time here.
And where's this available now?
Now, right now, in Europe and in Canada, it's being used. And in the United States, we're using it in clinical trials so that we're giving it to the FDA for approval, and it should be happening soon.
Good stuff. Thank you so much for joining us. And Denise, congratulations.
Many more moms are taking their bodies back in ways that a gym workout just can't fix.
The American Society of Plastic Surgeons says they are correcting the downside of breastfeeding. And as our Joyce Evans reports, they have many more options with less scarring at a cheaper cost.
Turn around, yep.
35-year-old Jessica Williams has 2 small children.
What do you say?
Mila, 2.
You're welcome.
And Philip, just 1 year old.
Where's another one of our favorites?
They are the lights of her life.
Sleep, baby, sleep.
But she's covering up an embarrassing problem, according to her.
Here's another one.
Breastfeeding has knocked her figure completely out of whack. So much so, she says she can hardly find a bra or other camouflaging garment to conceal the saggy and lopsided look.
I do a push-up.
Jessica is a growing number of moms who want to have their kids and curvy figure too.
I feel that I can, be this again.
But what about societal backlash? Those who would say a changing figure is expected and part of the beauty of being a mom.
And just because you're a mom, I don't think you should let yourself go.
Hi.
Hi.
How you doing, honey?
I'm good. How are you?
Plastic surgeon Dr.Davis says there are basically 3 options.
See if we're going to be able to fix that up.
A lift, cutting away excess, repositioning, and stitching up. Implants, filling the void, or a combination of the two.
I probably wouldn't want to get so much done.
But returning to her pre-baby B cup through a breast lift,
I think we just stay with the high-profiled implants.
Is not the best option for Jessica.
We can take these new silicone gel implants that have these higher projecting qualities and literally give a breast lift simultaneously with giving more fullness.
She wasn't expecting to hear implants.
I am overwhelmed.
But still willing because she'll have fewer scars. So she is sized up and marked up. The doctor figures it'll take about a 500cc implant to fill the bill.
You could really see the size difference once one implant was placed and when we compared it to the other side.
The trick, he says, is to keep it looking real.
We actually used a sizing device to show what really would fit perfectly. I think she's going to really love it.
It's going down.
A couple of weeks later.
Wow. They're phenomenal.
Are you happy?
Yeah, I'm very, very happy.
You can see that they basically restored her shape.
Where's the scar?
I'm telling you, go find it.
Hidden inside a natural crease. Jessica says she hasn't missed a beat. Not with these two.
There you go.
But she's taking it easy on the heavy lifting and
immediately bringing them to my hip.
All that tight snuggling. Hi. Joyce Evans, Fox 29 News.
The doctor says her new breasts will settle into an even more natural position soon. A mommy breast makeover can run anywhere from $6,000 to $12,000. Jessica's cost $6,500. Important to note the procedure, the cost, and the scarring depend on what needs to be fixed, and your insurance company will probably not cover it.